Hello, this is Danny Blyth from CICM, and we're looking at pulse depth, floating, deep and normal pulses. Remember, this is for Chinese medicine students only. Please pause and read this. So first of all, to put it into context, when we're taking a pulse, we look at depth, width, strength, shape, rate and rhythm. These are all different variables. We look at them all individually. We also look at the root of the pulse, whether the pulse has stomach chi, and the shen of the pulse, the spirit of the pulse. So for now, we're just focusing on the depth of the pulse. So a normal pulse, you touch the skin, your finger reaches down and you feel the pulse. You pass through the pulse, feel the quality of the pulse, and then there's a gap between not feeling the pulse and the bone. So you feel the pulse in this sort of middle third of that length. With a floating pulse, pretty much as soon as you put your finger on the pulse you feel it, and then there's a large gap between not feeling the pulse and the bone. So you put your finger on, you feel the pulse, and then there's a large gap until you hit the bone where you don't feel anything. Conversely, the opposite is true of a deep pulse. So you put your finger in where you would expect to feel it, you don't. You pass deeper and then you feel the pulse, the quality of the pulse, and the gap between not feeling the pulse and the bone is quite small. So in the simplest of terms, a floating pulse represents an external invasion if it's full, or if it's a sudden change or yin deficiency. A deep pulse represents an internal problem or yang deficiency. So broadest of brushstrokes. So the deep pulse, the character has water on the left, and on the right it has a house with a person in it, and it can mean sinking, heavy or deep, like a stone thrown into a well that sinks to the bottom. So clinically, a deep pulse, if it's deep and weak, it means that there's a qi or a yang deficiency. It can also mean there's a blood deficiency, and the qi and blood cannot fill the organs and the channels, so the pulse remains deep. If the pulse is deep and full, it can mean that there's a stagnation of qi and blood interiorly. It can mean that there's interior heat, or that there's interior cold, which you would tell by the rate or other qualities of the pulse. And there may be a kidney deficiency, but there may not be. Basically, the pathogenic factors collect internally and they block the flow of qi to the surface. Deep pulses are more common in large and overweight people and can be considered somewhat constitutional, and they're also more common in the winter. So the floating pulse, character shows again, character for water, so the idea of floating on water, and it also shows a child wrapped up in swaddling here, and a hand lifting it up, so lifting a child. So another image for floating, like wood floating on water. So with a floating pulse, if it's a sudden floating pulse, it can mean there's an external pathogenic factor in the exterior, wind heat, wind cold, any of those things. If it's full, interior excess. If it's empty, interior deficiency. So if it's exterior deficiency, you need to regulate the yin and the wei qi. So the yang rises to the surface in defense of the exterior. If the pulse is weak, then you get a yin deficiency and the yang floats up to the surface. Some less common causes, floating yang, so the yang can float to the surface. Often see this on the liver when the pulse is floating and wiry. Can be severe qi deficiency when the yuan qi is very deficient, extremely deficient. The pulse can become floating, and unusually it can be an interior wind. Floating pulse is more common in thin and underweight people, more common in the autumn, and more common with patients that are taking vasodilators, so people on some blood pressure medication. So some quotes from the Mai Jing, the earliest comprehensive text on pulses. The sunken pulse, raised it is insufficient, pressed it is superabundant, and the floating pulse, the opposite, raised it is superabundant, pressed it is insufficient. So going back to what we said at the very beginning. So to review, the floating pulse is felt near the surface, normal pulse is in the middle, and a deep pulse is felt close to the bone. Some important things to note. Depth is unrelated to strength, so a pulse can be deep and weak or deep and full. It can be floating and weak, in which we call it floating empty, or it can be floating and full. So remember, depth, width, strength, shape, rhythm and rate, all different spectrums. So think of depth and strength as two completely different things. Also important to remember that a deep pulse can feel somewhat weaker because it's deep, and a floating one stronger. So make sure that you normalise what you're feeling.